During the third stage of labor, you can perform a series of procedures to reduce the risk of postpartum hemorrhage. This intervention is called active management of third stage of labor. Give a uterotonic drug. Prepare to have a dose of oxytocin ready before the birth. Give 10 units of oxytocin intramuscularly or intravenously if an IV infusion line is already in place. Oxytocin should be given within 1 minute following the delivery. Oxytocin only works if it's been stored at a temperature between 2 and 8 degrees Celsius. If heat-stable carbetocin is available at your facility, you can give 100 micrograms intramuscularly to the mother as an alternative to oxytocin for the prevention of bleeding. Do not use it for treatment. See drug list for details. If oxytocin or carbetocin is not available, you can give the woman 400 to 600 micrograms of misoprostol orally. Assess the newborn. Start a clock or note down the time. Immediately after the delivery, dry the newborn thoroughly with a towel and assess. Remove wet towels and cover to keep it warm. If the newborn is crying and breathing well with a good color, moving its arms and legs with a good tone, and has a heart rate above 100 beats per minute, proceed with routine initial care of the newborn. If the newborn is not crying or breathing well after drying, is limp, and does not move and has a bluish or pale color, you need to proceed to neonatal resuscitation immediately. If the baby is born with meconium, or if secretions are blocking the mouth and nose, and you need to resuscitate, first clear the airway. Suction before you start to ventilate. It's important that you suction meconium out of the newborn. Be careful not to blow meconium further inside the newborn. Clamp and cut the umbilical cord. Unless there's postpartum hemorrhage or the newborn needs resuscitation, you clamp and cut the umbilical cord when the cord stops pulsating or 1 to 3 minutes after delivery. Controlled cord traction. The placenta may be allowed to deliver physiologically or can be delivered via controlled cord traction. See action card. You start the delivery of the placenta by holding the cord tight and pulling it very gently in the direction of the birth canal. With the other hand, you apply counter pressure above the pubic bone. Within 2 or 3 minutes, the uterus usually becomes rounded and the cord lengthens. Instruct the mother to push and then gently pull the cord downward and then upward to deliver the placenta. Gentle twisting of the placenta as it delivers helps keep the membranes from tearing. Check the uterus. Feel whether the uterus is contracted and check for bleeding. Measure and record blood loss. Examine the placenta. If the condition is normal, you then examine the placenta. You examine that the membranes are intact and that there's no tissue missing on the maternal surface. Monitoring. Avoid separating mother from newborn whenever possible, and do not leave mother and newborn unattended at any time. Examine the perineum, vagina, and vulva for tears. Give pain relief and suture if needed. Remember to check the condition of the mother and the newborn after the delivery. Check whether the uterus is well contracted every 15 minutes for the first 2 hours, and check the woman's blood pressure and pulse to be sure her condition remains stable. Make sure that there's no excessive bleeding. Assess APGAR score at 1, 5, and 10 minutes. Keep warm by skin-to-skin contact with the mother. Monitor the newborn closely. Check breathing and color every 15 minutes. Check the cord for bleeding every 15 minutes. Keep it clean and dry. If bleeding, retie it. Give vitamin K intramuscularly. 1 milligram for newborns weighing more than 1,500 grams and 0.5 milligrams for newborns weighing less than 1,500 grams. Start breastfeeding within the first hour after birth and let the newborn feed on demand. If feeding problems, see feeding chapter in the low birth weight film. Examine the newborn, looking for danger signs. Apply antibiotic eye ointment. Treat the cord according to local guidelines. For example, apply chlorhexidine digluconate, 7.1%, for umbilical cord care. Give vaccines according to national guidelines. Weigh the newborn. If less than 2.5 kilos, consider the newborn low birth weight and at risk of complications such as low blood sugar, respiratory distress, and severe infections. For further management, see low birth weight film. At discharge, ask the mother to return if the newborn shows any danger signs. Keep the mother in the delivery room for a minimum of 1 hour after the delivery of the placenta. By performing active management of the third stage of labor, you can prevent a postpartum hemorrhage.